Good evening and welcome you to another episode of iMed, and today we're going to take a look at your oral health and to discuss about common dental problems that we face nowadays, especially in this population. We're going to talk about this. You're going to take through this and to give you some tips as well how to maintain your oral health, your dental health. To do the honors today also we do have with us Dr. Sirimevan Samarakon, consultant in restorative dentistry at the Teaching Hospital Ratnapura and also a visiting lecturer at University of Peradeniya. Good evening to you, doctor.
Good evening.
So to start with, now there are certain dental problems that we face in the day-to-day life. So what are the common dental problems that are prevailing here in the society?
Most common dental problems that we encounter either among children or in the adult population in Sri Lanka is dental caries. And along with dental caries, the perceived problem that the patients are coming to our clinics is with dental pain and food lodging. So, the reason that they experience this dental issues is most of the time is either because of the diet that they are having or either because of the cleaning efficiency is lacking in their day-to-day oral health activities. And along with dental caries, which can lead to dental abscesses and along with severe pain and swelling as well. And then you have periodontal problems, that is like gum problems, which is very, very prevalent in Sri Lankan population as well. And sometimes we experience dental injuries, especially in centers like where I work, especially for teaching hospitals. We get a lot of referrals regarding dental injuries. And then we have especially in the estate sector, we have oral cancer related issues. And then we have among the general oral health in Sri Lanka is not that you can call it as not optimal. So because of that, a lot of people are in Sri Lanka are without their full set of teeth. Then they have missing teeth and all the related problems which arise out of the missing teeth. So those are the most common things that we experience.
And doctor, could you please elaborate us on the management aspect of these dental caries?
Yes, as we can see in this, the first tooth on the left side is a tooth where you are having almost the pristine condition, in a pristine condition, but you only have a small black lesion or a color on top of the tooth. So in that aspect, this is a dentinal caries. This is what we call is a dentinal caries, limited only to the top part of the dentine, and this can be treated with a very simple restoration, or what we usually call it as a filling. And if you see it in the other tooth, or on the one which is on the right, that lesion has extended somewhat deeper into the dentine, and the red area is the area where you have the nerve and the blood vessels inside. We call it as the pulp cavity. So when the lesion is getting nearer to the pulp, or if it is in the pulp, then the patient is experiencing severe pain. Along with that, sometimes swelling as well, and sometimes discharging sinus or abscess is also there, and all the other related problems like difficulty in opening the mouth and difficulty in attaining sleep and constant pain, throbbing pain, and generally reduced quality in life, and he or she needs immediate treatment for these things. So in this kind of situation, we only have two options. Either if the patient wants to retain the tooth, that is to keep the tooth in the mouth, then the patient has to do a root canal treatment. Or if the patient doesn't want to retain the tooth, or if that tooth is a non-usable tooth, then the patient has to extract the tooth. So in the other one also, it can be nicely explained. As you can see on the left side, you see a tooth which is a severely infected tooth and giving rise to an abscess, and the abscess is inside the bone, and because the abscess cannot get discharged, the patient is experiencing severe pain because of the pressure build up. And once you do a root canal treatment, that is cleaning up the inside of the canal, allowing the abscess or the pus to get drained out, and once you do a root canal filling, replacing the missing part with a material which is somewhat, we can call it as biocompatible, then you can use that tooth as a normal tooth, and that tooth can be used for function as well as for aesthetic purpose for a very long time. And especially in the scenario where you experience this kind of situation in the front tooth, where you have to have because of cosmetic and functional reasons as well, this is the best type of treatment.
And another common problem is like associated with this kind of caries and also other dental problems, the toothaches, the pains that we get, unbearable pain which occurs especially at night or evening time. So, doctor, how to manage this kind of pains? Now, some have sensitive tooth as well. So, what can be done in this case?
The first thing that has to be done is to properly diagnose what is the cause of the pain is. Like what you mentioned, if it is a sensitivity which is giving rise to a pain, most of the time it is because either a part of the tooth is exposed where it should not have been exposed. It could be from one side where the gum has gone down and where the root has gotten exposed. So, in that sense, a simple covering up those exposed areas will relieve the patient of experiencing these sensitivity issues. And in certain instances, there might be restorations or fillings which are inside the tooth which are leaking. Then the fillings has to be replaced. And in certain instances, because of that filling which has been leaking, it has given rise to such a scenario where this bacterial penetration has gone all the way to the nerve. Then, like what I pointed out or mentioned earlier, you have to initiate a root canal treatment. So, depending on what type of issue that the patient is experiencing, first the clinician has to determine whether the pain is of dental origin or not, because sometimes certain neuropathic pains or neuronal pains or pain of neurogenic conditions mimic dental pain. So, if the patient or if the clinician initiates unnecessary dental treatment, then that itself will lead to further aggravation of pain as well. So, it is very important that we diagnose the correct cause of the pain, and depending on that, if it is dental pain, it should be managed in such a way, along with what I have told you, it should be managed with pharmacological means as well, various antibiotics as well as painkillers, potent painkillers or non-potent painkillers can be given to alleviate the issue of pain. And even during that medication itself also, there are possibilities that the clinician should attend to further treatment issues like removal of the filling, doing a temporary filling, waiting until the pain goes off, and then redoing a permanent filling and things like that.
And doctor, now if a tooth is extracted, or in that case there's missing teeth in our oral cavity, what are the problems that one can encounter with it?
Well, like what I mentioned earlier, obviously a person will not be satisfied or will not be comfortable at all if the person has lost the front tooth or whatever the teeth that are available in the front
because
side
of the appearance
mouth.
mainly.
Especially because of the appearance. Fortunately, in this era, because we are in mass, we might not be having that amount of difficulty, but in future when it is time to remove the mask, it will always be a problem. And along with that, people would have experienced the problem of pronouncing correctly when you don't have teeth or certain teeth which are helping in certain pronunciation of certain words. So, for speaking also, the retainment of certain teeth is very important, and people with missing teeth experience reduced efficiency of mastication, that is, they cannot chew as a normal person, or else the teeth which are instanding, the teeth which are in the mouth at the moment, they get weared off very quickly because now they are receiving too much of force as well. And in instances where one side of the mouth has undergone a lot of extraction, whether patient by design or whether patient because doesn't have any other option, they tend to eat from whatever the teeth or wherever the side where the teeth are most. And what happens is, in the longer run, the joint, we call it at the temporomandibular joint, it's where just in front of the ear we have the joint from both sides, then that side of the mouth gets more and more, and there's a tendency for the joint to get weared off very quickly, and patient might be having joint pain as well. So overall, a simple issue can lead to major issues in the longer run, because an acute problem will lead to chronic problems because of the loss of teeth. And on top of that, because of the created space that results after an extraction, it will result in tilting of teeth towards that space and spacing of teeth, especially in the front teeth as well. So it will lead to again cosmetic problems and the problems that I talked about as well. So it's very important that you try to retain as much as possible your own natural teeth rather than looking for alternatives.
What are the solutions that are available in order to replace these kind of missing teeth?
Well, for the last, I would say 150 years or more, people have resorted to thinking that the only solution to this problem of missing teeth is dentures. So that is, you can call it as a very old practice, because dentures could be full mouth dentures like what you can see here, or it could be partial dentures. Full mouth dentures, it replaces entire set of teeth, either in the upper jaw or in the lower jaw, or in the lower on the lower margin of the photo I can see they are called partial dentures. It replaces certain number of missing teeth. But this has been a practice for such a long time. Now people are getting fed up with this practice, and now we are moving on to a stage something like, for this instance, this is called a resin bonded bridge, especially for children who are of a growing up age, or especially for people who are not really fit to undergo surgical procedures, or especially for people who have certain medical conditions which you can call as preclude undergoing extensive dental treatments. This is the choice, and this is as you can see, not a removable denture or not a removable prosthesis. This is also a fixed prosthesis. This is called a resin bonded bridge. So as like what I told you initially, because it's called bonded, it's using a certain cement, we bond the missing tooth to the existing teeth. But the beauty of this is we don't cut any existing teeth. We don't intentionally damage teeth in order to replace missing teeth. So this is a very much sought out treatment nowadays, especially in United Kingdom and other parts of the developed countries. They are very enthusiastic about this, because the bonding systems which has come by, they are very encouraging. It gives long term results for about 5 to 10 years, and this is the treatment most of the time we prescribe for children.
Is this available in the government sector?
It's available in the government sector as well as in the private sector.
So another common problem that we have is the discoloration of teeth. What are the causes, and doctor, how can we avoid the discoloration of our teeth?
Yeah, before talking about discoloration, I'd like to point out another type of missing dental treatment, teeth treatment as well.
Yeah.
So in this one, you can see what I talked about, like how the patient's facial contour changes because of the loss of teeth, and associated with the loss of teeth along with the loss of bone as well. So in this slide, you can see the side of the face is changing rapidly because of the loss of the tooth, and when you lose a tooth, you lose surrounding bone along with that. So for this now the trend is to go for the dental implants. So compared to a normal tooth, you have the dental implant. So the implant or the fixture, the screw as we call it, is the one which is replacing the root part of the tooth, and the crown part is getting replaced by the by an artificial crown, that is the one which is visible to the normal eye. So in this instance, because now the technology has experienced or advanced to such a stage where you can see even the entire arc, entire set of teeth in the jaw, it can be replaced by these dental implants. And this is a case where you can see where the person has initially experienced loss of tooth, And this is as like what I told you, a surgical procedure where you expose the gum and then you drill the bone, you create a space for the implant where you can see a small metal part jutting out from the bone. That is where you replace the root, and then on top of that you replace the part which is missing, that is the crown as well. In here you have replaced the crown then and there at the time of the surgery, so we call this as a temporary crown. But the permanent crown, matching the shape, size as well as the color of the other teeth, will be given after 6 months time if it is in the upper jaw, and if it is in the lower jaw, within 3 months time we can give those things.
So that are the treatment availabilities here in Sri Lanka as well with regards to missing teeth. And
Exactly.
turning back to discoloration after.
Yeah, now one of the reasons that patients seek dental treatment is because cosmetically they are affected, and one of the reasons that cosmetic effect is there because of change of color. So change of color can be due to a genetic reason, can be due to a pathological reason, or could be due to a iatrogenic reason like placement of a filling. So when it comes to management of dental discoloration, first of all we have to determine what caused this discoloration. Like what I told you earlier, if it is a genetic discoloration, we have to give a guarded prognosis for the patient's aspirations, because most of this time patients come with certain expectations, and if it is cosmetically motivated, they expect a certain high standard of restoring to the level that in a normal person's appearance. But in certain instances it is not practical. But in certain instances, if it is because of an infected tooth that the tooth has gotten discolored, if it is because of a restoration that the tooth has gotten discolored, or especially in Sri Lanka, where in certain areas of this country where we experience high concentration of fluoride, and because if it is because of fluorosis, if the patient has discolored teeth, of course there are certain ways like bleaching of teeth, or putting veneers on the surfaces of teeth, or even putting crowns on teeth, where it will restore the patient's, or rather it will increase the patient's appearance in such a way, it will increase the patient confidence, even the function, and sometimes the overall picture of the patient as well.
So that being said, regarding the discoloration process, now I would like to turn to the surgical aspect, or the surgical procedures that are being conducted at a dental clinic. Usually when it comes to surgeries, we think that it's being done at a theatre, but what are the surgical procedures that can be done at the dental clinic itself, Doctor?
Because it's very important that we try to do as much as possible these surgical treatment procedures in the dental clinic itself, because general anesthesia is always time consuming, expensive to the patient, or as well as if you are doing it even in the government sector, is expensive to the government, and it always comes with certain amount of risk as well. And if you can do those most of the local procedures under local anesthesia, it is, I think, beneficial not only for the patient and for the entire health system. It is beneficial. So the surgery that I showed you earlier, like implant procedures, most of the time can be done in a local setup, like in a normal dental clinic. And things like this, where most of the time people experience like impacted wisdom teeth, most of the time this can be removed at a local dental clinic under local anesthesia. And depending on the position of the tooth, or in the other one we can see in this X-ray, so you can see the last tooth in either side, in the upper jaw as well as in the lower jaw, they are positioned in various different ways. So depending on the clinician will decide depending on the position of the tooth, how difficult it is, and taking into consideration the patient's aspects as well as the local aspects as well. Most of the time these can be done one at a time in a dental clinic under local anesthesia. And some of the dental surgeries like periodontal procedures, like taking the gum from certain areas and doing some plastic dental surgeries, can be also be done under local anesthesia in a dental clinic. So it's like this. In this one, you can see on the left side how the lesions were before the procedure. More exposed root surfaces are there, and now the gum has been taken from somewhere else and has been split. The gum has been split, and the plastic procedure has been done, and sutures have been placed there, and you have achieved good cosmetic results. And all of these things have been done under local anesthesia in a dental clinic, without going to the or rather without looking at the requirement of a theatre there.
And turning to you, doctor, regarding the cosmetic dental treatments, what are the availabilities as well as other associated other treatments?
Well, looking at this, you can see this smile of this lady is world famous. Now this is Julia Roberts, and the main marketing tool during her career was a smile, and it is a smile which encompasses a lot of things. Now you mentioned about, and we talked about the whitening of teeth or the management of
the
discoloration. So as you can see in this picture, her teeth are all white, very white, because of the bleaching that has been done. And on top of that, if you look at the notice, the lip line, it is full lip line because of the Botox treatments that were given. And the lip is full, and not only that, if you can see, her teeth are aligned perfectly as well. That is because of the orthodontic treatment that has been done to her some time back, but still which is in very good condition. So overall, if you look at a person's smile, you notice how good the teeth is, but it's not only the teeth, it's the overall picture that the person projects. Where the lip is, how full the lip is, how the alignment of teeth is. So this encompasses a lot of subspecialties, not only in dentistry as well as in medicine as well. Now I mentioned about orthodontics, that is the alignment of teeth. Now I mentioned about Botox, that is most of the time dermatologists or sometimes plastic surgeons or even sometimes oral and maxillofacial surgeons, they are also involved in giving treatment for this. And sometimes if there are some scarrings around the cheek area or around the lip area, then there's always an option of undergoing plastic surgeries to correct those things. So when you are going to get the perfect smile or the smile that you want, you have to understand that it encompasses a lot of subspecialties coming into one and working in harmony to give the most aesthetic or the most beneficial product for the patient.
That is about a smile, and also regarding the cosmetic aspect. Now doctor, before we wrap things up, would like to know one final message to our viewers in order to have a good oral health.
Well, first thing that you have to know is your oral health depends on how you look at life. So, and your mouth reflects the way of life that you expect you to be. It's like the quality of life that you want will be a reflection of your oral health, and it's on you to your own responsibility to look after your health as well as oral health, because it's by doing very simple things like looking after your diet or controlling your diet, and cleaning your mouth regularly, and regular dental checkups at least once a year will be sufficient in most of the cases to get you over the goal of achieving optimal oral health. And along with that, which is beneficial for your general health as well, to stay away from detrimental habits like smoking, consumption of alcohol, and sometimes even protective habits like wearing a helmet or wearing seat belts will go a long way in maintaining your oral health in perfect order for a long time to come.
Thank you so much, doctor. That has been very important to us throughout the episodes as with regards to our oral health and how to maintain a good oral health in order to prevent these kind of issues occurring here and there. So we'd like to thank Dr. Sirimewan Samrakon, consultant in restorative dentistry at the Teaching Hospital Ratnapura and also visiting lecturer of University of Peradeniya, for being with us on iMed and giving this information to our viewers. Thank you so much, doctor.
My pleasure.
And inviting you to join another episode of iMed next Thursday as well. We are wrapping it up from today's episode. Take care. Have a great week.